Hi everyone, welcome to the question of the week. The question of the week comes from Cameron, who is out at Messiah University, who's a second year PT student. And the question is, what are your thoughts on trying to get the CSCS done while being a full-time PT student? And he says, I've been listening to your podcast for a while. I'm just wondering, should I do it? I understand you think I should get it done, but is this worth my time? So I have a couple different options for you. First of all, thank you for sending that question in. The options are, in an ideal world, you get your CSCS prior to getting into PT school. That's option number one. Option number three is that you get the CSCS after PT school. Now, that may or may not be ideal based on your own perception of like what you think that employers or residencies are going to do. So either way, so there's plan one or plan A is to get it before PT school. Plan C is to get it after PT school. And now you're in plan B. So you're in it, and what do you do now? Now, within being in PT school, I have a couple different options. Number one would be to choose the slowest quarter or semester. That is completely up to you, but use your strength. So if you're really good at anatomy and you have a heavy anatomy course or semester or whatever it is, you can use it during that time. If you know you're not strong at anatomy, you know your attention is going to be there. So if you're going to choose your slowest quarter, look at the courses that you know you might have a strength in or whatever it may be. So the other option is that you can do it during your clinical rotation. So yes, you're going to be working hard and doing all this other stuff, but on Saturdays or Sundays, you can commit to that and just do the darn thing and do an hour or two. And if your clinicals are 6 weeks or 10 weeks or 12 weeks, you can do it during then. The other one is to study hard during a winter or a fall or a spring break or summer break. So if you know that you have 2 weeks off or 4 weeks off in the summer or 1 week off in the fall or 3 weeks off in the winter, then you use those time points to just crush it and use that time to be productive with the CSCS studying. The other one is to do a slow study over 4 to 6 months. This is definitely how I would not do it, but that's just my personality. So you can do it 4 to 6 months and just do 1 or 2 hours a Sunday and just commit to the darn thing. And so you have a slow roll over 4 to 6 months. You've got a crush it time period where you just chunk it during breaks, or you do a slow quarter or a slow semester, or you do a study during your clinical rotation. So the next question is, does this really impact your application to residencies, employment? If you ask me, if you're a physical therapist applying to sports performance physical therapy, does it directly affect it? No. Does it enhance it? Sure. But it goes around the whole profile. So I want to see, does that can that apply, and is that going to be able to be applied to patient care? That's probably the most important thing you have to understand is the application. So you're going to have all these initials, all this education, all this knowledge, but the application is probably the most important. So you have to prioritize, is your application going to be strong to residency? Is it going to be strong to future employment? Are there other things that you have? The CSCS would just be an icing on the cake. So you have to answer those questions first. So if you're going to do this in PT school, is it worth your time? Should you be volunteering, using that time elsewhere to focus on whatever it is? Do you have the grades and buffer to be able to do that? And do you have slow or challenging quarters coming up that you can allocate extra time towards that? So I'll let you answer those questions. So if you have anything in that realm, I'd say ideally you get it before PT school. If you're in PT school, here are your options, and you can do it. Plan C is to do it after PT school, completely up to you. What is my preference? Obviously before PT school. If you're in it, what would I do if I was in PT school and I really wanted it? I would do it during breaks or a clinical rotation where I know I'm actually going to be able to apply it. So in an ideal world, you're in an orthopedic setting or a sports setting, and you double down and study for your CSCS, because now you can integrate it and apply it. And it's not just studying, it's actually applying it. So it's like being in class and being tested on it. So that would be my ideal scenario. Do it in a clinical rotation where it's most applicable. That would be my answer. So I hope that helps, Cameron, wherever you are, and anybody else who's had that question. And thanks again for sending in all these great questions of the week. If you have one as well and you want me to answer it, send me an email, drchris@drchrisgarcia.com. Thanks.